Welcome back to Beyond the Clinic Walls, the podcast dedicated to helping medical practices thrive by leveraging technology and innovation. I'm your host, Roby Flynn, and today we're exploring a fascinating model of integrated care and performance optimization from our neighbors to the north. I'm excited to introduce our guest today, Francesca Sebastian, the CEO of Acumen Health, a premier private surgery, reconditioning, and performance center based in Canada. Thank you so much for joining us all the way from Canada. Could you start by telling us a little bit about Acumen Health and the unique model you guys have built, integrating surgery, reconditioning, and performance?
Yes, of course. It started with our founder. So our founder is Dr. Jesse Slade Shantz. He's an orthopedic surgeon, specializing mostly in shoulder, elbow, and knees. So his story is a bit interesting, and that'll give you a little bit of a perspective on how the Canadian healthcare system works as well. So he had a public practice, and of course, in Canada, healthcare is a publicly funded model, so everybody has access to it. So yeah, he was a public surgeon in the province of Ontario. Really good practice. He was working in the hospital there, all good. But he moved to a different province in Alberta. When he did that move, it was because of his family, so he moved. When he moved to Alberta, unfortunately, the healthcare systems are regulated provincially. So when he moved to Alberta, he didn't necessarily have a position available in Alberta to be able to practice. So as an orthopedic surgeon, obviously you want to use your skills, you want to practice what you've studied and you've done. But he wasn't able to do that. He would have had to wait like a long time to be able to have that position in the public system. So he explored the idea of opting out. So again, just because it's so different here in Canada, opting out of the public system is something that is quite rarely done here. Private practices are not very common. And each provinces also have their very different rules and regulation about opting out or doing a private practice. So he kind of explored that option of opting out and decided to do it himself. So opting out and then creating his own private practice. So Acumen was born exactly in that same time he opted out. It was his practice. But finding patients or letting know or telling the public or the population that there was an option for private is something that it's unknown. So also, how do we go in front of patients and tell people that there is an option for private? This is something we deal with on a daily basis at Acumen. So it started very slowly, and we seen patients one at a time. But the reconditioning, so the rehab and performance sector of Acumen was also born with the orthopedic surgery just because we wanted an all around care, not just the surgery, but also making sure that people really had amazing outcome. So surgical practice started as well as the reconditioning and the performance so that patients had good outcomes after that orthopedic surgery, because it's not just about the surgery. 50% of it is also about the rehab.
That's perfect. I love the integrated approach behind all of this. So, how does bringing surgery, reconditioning, and performance under one roof enhance the patient journey and ultimately improve outcomes, especially compared to more fragmented care models?
Yeah, so again, when patients are going to the hospital for a surgery, they have to find their physio themselves, right? Their physiotherapy, they'll go back to their community and find a physiotherapist, and that's okay. There's no problem there, and that's what people are used to. But we saw at the beginning, actually, we worked with a lot of physiotherapists in the community, and that's also great. But we really like the communication between the team members. It's something that we do very differently than probably other clinics like physiotherapists, even physiotherapist clinic, is that all of our members of Acumen are actually employees. So even physiotherapists that in Canada, you'll see most of them have a split fee, or they're contracted for the amount of patients that we see. We like to have employees that are completely integrated with the Acumen models. Not only do they see patients for rehab, they're also in the room with the surgeon during the consultation. So they're scribing, some patients are surgical, some patients are non-surgical. And so oftentimes when they're non-surgical, the therapist is already in the room and understanding the diagnosis with the surgeon. So that really integrated approach is super important for us. Another thing too is when we didn't have the therapist at the beginning, our orthopedic surgeon would call these physiotherapist clinic and give them the OR note. This is something that's actually not something that you see in Canada here. We don't share the OR note with the physiotherapist, right? So they would all be surprised about this, like, oh my God, I'm getting a surgeon's call and they're sending me the OR report. But we wanted a team of members that are within the surgeon. It's also different for the surgeons. When the surgeons are onboarded at Acumen, like now we have 19 surgeons, actually, not just one. But when they're onboarded, it's also very important for us that they're okay, and then they will be working with the athletic therapist very closely with them. So that it's a big piece. We also have gyms. So it's not it is a clinic setting, but it's also a gym setting. So oftentimes, yes, the therapists are in the clinic section, and then all of a sudden they're in the gym with the patients, and the surgeon is going to stop in the gym to check in on the patient. And that is like, we love that. We love that whole clinic approach, and therapists would say if they were here right now, they would tell you that a surgeon's opinion too is kind of like their magic wand. Like, oftentimes patients just needed to hear it from the surgeon so that they have, like, a successful, like, outcome with patients. And then after rehab, oftentimes people really they like the setting, they like the communication with the team, and they just wanna stay and do more active rehab. So that's why the performance department was actually born, is really to help that active rehab and maybe more athletic patients. So we do have that as well. So oftentimes when they're done with the athletic therapist, they'll move on and see the strength conditioning specialist. But all these people are working together. And oftentimes I'll walk into the gym and there's more than one therapist on a patient, just kind of like brainstorming ideas. And it gives a different approach and a much better outcome when a lot of people are putting their brains together rather than having someone that's like, subcontracted to see one patient. It doesn't allow them to want to share the patient either. So we do really believe in that, and all of our locations across Canada are like, we have people employed with Acumen and work with the surgeons on a day-to-day basis, and that changes.
Yeah, if I ever tear my rotator cuff, I'm definitely coming to Acumen Health.
You can come to Canada.
Yeah. So given that you're in Canada, how does operating a private center within a publicly funded healthcare system influence your approach to patient care, business model, and the services you offer?
Well, again, like, each province are completely different. So you do have to adapt quite significantly. And it's also what's mediatized because each province will like, so okay, so in Alberta, for example, where I reside, again, it's most patients are coming in and they tell us that they had no idea that they could have private here. So, it is a thing. Most Canadian are actually going to go to the States or leave Canada for healthcare. So it's really, I think our biggest challenge is to let patients know and people know that we do exist. And then you'll often have like, it's kind of a mentality here that if you want to go private, you have to leave your province. So if you have your provincial healthcare card, you can have private healthcare within the same province. So you often see British Columbia patients coming into Alberta to get healthcare, and vice versa. Albertans will go to British Columbia to get healthcare privately, not publicly. But publicly, the thing is, a lot of patients are the reality of the public healthcare system is it's great, for acute care, but when you do need a surgery, an elective surgery, a surgery that's not urgent, unfortunately, you'll be waiting a long time. I'm not pulling any stats here, but on personal experience and what our patients are telling us when they come to our clinic, patients here in this exact province in Alberta are waiting 2 to 3 years to be seen,
Wow.
sometimes for a rotator cuff surgery or a knee surgery. And the reality is that some patients can't wait. We do see a number of farmers that, that's how that's their career.
Mm.
They have to be moving. So for them, waiting 2 years is just not an option. And they often leave the country. Whereas, like, really, we do have options in the province. So it's really being in front of patients and for them to understand that there are options in their home province. And that's really the goal of what we're trying to do in Canada, is that, yes, everybody knows that there's public funded surgeries. But depending on where you are and the accessibility of the care that you will get publicly, sometimes it's really hard for patients, and it'd be really nice for them to know that there are other options. And I don't think there was a lot of options ever in the past before Acumen. Whereas, like, we're trying to really create that private healthcare system because, again, I think patients should be aware of the choices that they have.
Definitely. Going back to like the whole reconditioning performance, the after
Mhm.
surgery stuff, how do you tailor these programs to meet individual needs, moving them from recovery to optimal functioning?
Yeah. Well, I like to share this story because before, we had clinics and everything. We did rent just little rooms in family physicians' practices to start Acumen. We just saw patients in different rooms that we would rent. And a fun fact is that I would actually myself sit in the waiting rooms of these clinic to welcome the patients, and I would really learn about them. Like, where do they come from? Like, I really did think at first when we started Acumen that people with a little bit more means would be coming to Acumen, but reality is that patients do need it for X, Y, or Z reason, right? And one of the first patient I've ever sat down with in the waiting room while the surgeon was just finishing up with somebody else, she shared with me, she's like, "Hey, like I'm a mom. I have a 2-year-old and I cannot lift her up because of my rotator cuff, and I'm not waiting 3 years to be able to pick up my baby." And her whole family came together and I think they pitched in for her to get her surgery. And when she was done, I was like, "Hey, do you mind like sitting down with me and telling me like how was your experience? How did what did you want to know more? Did we meet the expectation? Should I share more?" And there's probably like 15 patients that we really sat down and like went through it all from A to Z, understanding like the process journey and making sure that that's exactly what they were expecting. Because reality is, even though we have clinics, we have to rent surgical room in different non-hospital facility. And so sometimes you're working with external partners. You're not necessarily, yes, the surgeon's there for the surgery, but there's a team that are not part of Acumen that are there for surgery. So really understanding what patients are going through was really important for us to kickstart Acumen. And as we're now like 9 years into this, and I would say that year after year, we really do take the time to understand what patients are going through and we make the changes. I think big corporation, like even the public healthcare system, it is such a big organization that I think that changes are moving really slow. I know because I've worked in it too, right? You want to make a change in healthcare and it's like you have to go through so many different people and then your ideas, are they even going through? Is it even too late? Whereas like we are such a small organization, everybody is really hands-on the changes that needs to happen, that the outcomes for patients are being changed and chosen week after week. Like we constantly see changes at Acumen are like, maybe we should do this way for patients' outcome. And then surgeons, same thing. I've talked to surgeons that are like, "Hey, I kind of feel like a technician. I go into the hospital, I clock in, I clock out, and I do my surgeries. But like every time I have ideas, I don't really know if I'm listened to or if I'm taken seriously." Whereas like at Acumen, we really do. We take the time, we understand if they wanna make changes, then we make them, and I think it's almost like a a requirement for you to work at Acumen is to understand that, like, there are going to be changes week after week. Are all changes successful? Absolutely not. Sometimes we make a change and we're like, "Hey, it worked for this patient, should we change it?" And then we do, and it's like, "No, let's go back to what we were doing." So, in terms of patient outcome, I would say that it's very, very, like, based on real life story. Patients coming in day after day and understanding what they're going through and making the changes little by little to make sure that they have the best outcome. And when it goes through the surgery, but also reconditioning and performance, they also gather the number. They also see the patients day after day getting better during their rehab. So they often will, look at those numbers and say, "Hey, I think we have to make some changes in our program," or "Let's do it this way for this patient." I would say that most of our rehab are also very customizable. And that's why people have good outcomes, is because they all have different goals. You have the person that is an athlete and wants to get better quite faster for their sports goal, but you also have your senior that just wants to go hiking or go on a trip in Europe and be walking every day. So those goals are so different, and understanding that goal and making sure we customize programs for people is really important. And that's why we have good outcomes.
Yeah, that's great. I mean, just how individualized everything is amazing. Because I think and a lot of times in these big, healthcare conglomerates, you're just another number, and they don't really care. They just want your outcome to happen, and out the door you go. Just there's no kind of customization to it, really. Well, in terms of how complex running all this is, I would imagine, what are some of the biggest operational challenges you face in coordinating multiple services and ensuring efficiency across the surgery, the reconditioning, and then their performance?
Yeah. I think the biggest challenge is the external partners, in all honesty, because again, like we do like to customize things and we do take our time. And I think that it's sometimes hard for like surgical centers to understand that we're gonna book patients last minute. Like, they're used to booking, like, way far out, right? Like, when you're booking 2 years out, I mean, not necessarily in those private surgical centers, but in general, you book far out for these surgeries, so you have lots of time. Whereas, like, for us, no, we want to be able to get patients in within the next, like, 3 months max, right? When you want surgery, you want it now. So I would say that a lot of the challenges are, like, external sources. I think we can control really well what we're doing internally, but externally it's not easy. They all have also different ways of getting a surgery booked. So processes in all these surgical centers are it's challenging for us. We are working with, 13 different processes at a time. So when patients are coming in and they're like, okay, I do, the surgeon's like, okay, you do need a surgery. We will be giving all choices to patients. So we're not exclusive to a surgical center here in Canada. We are actually work with many of them across the country. So patients, even if they were seen in Alberta, a lot of them they want to stay in their hometown. But sometimes there's different pre-requirements for different surgical centers or different province. For example, in the province of Quebec, the age and comorbidities they're a lot more laxed in this province than in Western Canada. So for patients, sometimes they can't have surgery in Western Canada, but they can in the province of Quebec, in Ontario, for example. So it's very important for us to like put all choices in front of the patient. But when they're choosing whatever option they're choosing, then we have to do the process for that specific surgical center. So let's say everybody has EMR, so electronic medical record. Well, for us, we have our own, but again, we have to tailor it for every single process, every single form filling, every single like EMR that they're using. So I think it's like that's quite challenging. We're constantly looking at better ways and more efficient ways of booking people in, but oftentimes we have external sources that definitely puts a wrench in the way we want to do the processes. Yeah.
All right, well, speaking on that, how is Acumen Health trying to leverage technology to enhance patient care, streamline operations, or improve communications? Are there any specific tools or platforms that have been game changers for your guys' center?
Yeah, so we're using Salesforce actually, which is not I think super common in the healthcare industry. So yes, we decided to use a CRM for our electronic medical record. We basically built it ourselves based on our patient flow. It's also interesting to have a CRM because we can actually see where patients are coming from. Oftentimes they'll leave messages on our website, but it goes directly into our electronic medical record, which is really cool. And then we use DocuSign integrated as well with Salesforce. That's a huge tool for us. So every time patients are like filling different forms or health and histories, it's all pre-populated into our electronic medical record, which is huge. It's super efficient for our patient care coordinators that are mostly on the phone, educating patients and letting them know what their options could be. So that's been really useful for us. I gotta say, like we use it through our surgical consults, our rehab, and our strength conditioning. And so everybody have access to all the information for the patient. And our favorite tool is definitely like the chatter option where we can chatter ourselves internally. But we are definitely like exploring AI right now. It's not easy because we love to report. We love Salesforce because it's such a great tool to report on different diagnoses, the different metrics, numbers that we put into Salesforce. So that's a huge reporting tool for us. But when you integrate AI, sometimes you lose those like different fields for that. But we're exploring it. We're not opposed to it, but definitely it's funny. A lot of people are asking me like, why do you still have a scribe in the consult office with the surgeon? But reality is that people love it. They love to have multiple like practitioners in the room and understanding their issues like face to face. So for now, it's kind of a niche thing to also have someone scribing and being there and understanding what they're going to go through the surgery right? It's like, okay, this person's going through surgery. I'm going to help them pre-op. I'm also going to help them post-op, and I'm scribing with the surgeon. So there's this huge human approach that we have right now within all of our appointments, whether it's virtually too. There's never just the surgeon. It's always multiple members of the team that are there during the consultation. So we're exploring it. I would say definitely not opposed to it, but we're in that very exploration phase of using Salesforce and the AI tools that are embedded in it to be able to like make a better practice. But we definitely want our members to use it efficiently. Like, I do think there's a lot of people that use AI as a crutch,
Yeah.
and I also think that it's almost like a personal coaching that I want people to have about AI
Mhm.
and educating them about how to use it, because it's really, there's so much out there, and it's really easy to use so many different platforms that would potentially just like, is it even helping you grow as an individual?
Speaking on that, how does Acumen Health approach growth and innovation within your guys' unique model
Every day. I think
position?
we're always we're always open to different ways of working. I feel like we're constantly changing. We have new surgeons, and like, we've definitely started with a more orthopedic approach because most of our surgeons are in the orthopedic world, but really we want to build a separate healthcare system. So I think the innovation it's constant. Sometimes I'm not going to say it's too much, but I feel like
Well, yeah.
it's it's overwhelming. Yes, exactly. I would definitely have some employees right now that would say like, "Oh my god, every week there's something new and there's something different." It needs to make sense though. We're also very evidence-based. So I love that our surgeons are constantly meeting and trying to look at the literature and understanding the different pilot project that happen in different places on these specific tools. So no, constantly evolving in the medical side, um, and adding more services that we think patients want or are asking for or would benefit from. So oftentimes it's like, again, going back to this like patient journey and seeing like, okay, what would have been better for them, or can we customize it even more? So I would say it's more like adding services and things that are evidence-based for us to be growing. And the more we're growing in that sense, and the more we're offering Canadians a private options for different medical services.
Perfect. What's one piece of advice you would offer to other private practices, particularly in like your specialty, who are looking to integrate more, almost like the holistic approach that you guys have with the reconditioning and performance aspect into your patient care pathways?
Yeah, it's a good question. I would say that it's very easy to be doing your day-to-day tasks and seeing patients. And I think a lot of clinic are so busy, especially like rehab clinics and orthopedic clinics, just seeing patients over and over and over. That do they really take the time to like understand where patients' care is going? I gotta say, and I think it's all of healthcare. It's moving fast, but sometimes we like the evidence based is moving fast. We have new ways of doing things, but sometimes clinics are just really stuck in their ways, and it's like just about seeing patients. I love that at Acumen we have employees, again, like rehab practitioners that are part of the weekly meetings with everyone in the clinic, trying to understand the challenges of different people within the organization. Like, yes, there are performance practitioners, there's rehab practitioner, your surgeons, there are surgical coordinators that are really listening to patients. And I think that we have to be able to work more closely as a team, and meeting up with your team and having a really good culture and people that are happy to work within an organization is so key. Because when you have people that are really dedicated to your vision, then everybody's hands-on on making those changes. And oftentimes, I think clinics are really, really into just like seeing the patients, making sure they get their appointment and off the door. I'm actually worried about the future in terms of patient education. I think that we have a lot of work to do in educating our population about healthcare. And that is not just in orthopedics and rehab. It's like for everything. We're so used to just, going to the doctor, being told what pill to take, or what kind of things we should be doing, and not really asking any questions. This is like something that we should all do and take very seriously, is to educate our population and take the time. I love that our surgeons take 1 hour. I love that they sit down with them and they go through the imaging with them and they point out the evidence and they show them the options for treatment. And it's not also one treatment. It's also, I'm going to give you 3 options, and 3 options are good. Maybe one's better than the other, but really it's up to the patients. And if they're not educated, how are they making the choice for themselves?
That's great. I mean, truly, this sounds like the utopia of healthcare. I wish everything was like this. I mean, I work in cardiology, so it would be great. I mean, we have a cardiology therapy that comes and sees these patients after they get a stent or what have you, but it's not as all inclusive as kind of what you guys are creating. It's great. It's great.
Well, I think in the States, I visited a couple places in the States, and I think that there are definitely a few places that have the most integrated approach. But I thought we were like the exception of like, I guess we're a little bit of the exception in Canada. But I do realize that there are a lot of places like outside of Canada that do that. And I think it's great. I think we should have more. About being competitive too. It's like there is enough patients for like everyone. And and people are looking, they want a more integrated approach. So I think we do have to listen to our population.
I would agree. So, for our listeners who want to learn more about Acumen Health or connect with you, where's the best place for them to do so?
Yeah, so we have our website, acumenhealth.ca. That's a great place to like get to learn about what we do. We have a great founder video there too, as well as like the team members. We have like a rock star team at Acumen, so that's always really interesting to go read about our people and what we do. Instagram's a great place too. We share on Instagram, like we really do. All of our locations have their own Instagram, but Acumen Health is has its own as a clinic as well as Acumen Performance. And that's where you see your everyday, what happens in the gym and get to know some of our team members and the people that are there on a regular basis. So that's a great place to go. And of course, from there, you can always DM and hit the website to be able to ask questions to us, my email, and I'm pretty sure my phone number is even on the website. So that's always a place where you can reach and if you wanted to know more about Acumen or wanted to speak with me.
I feel like you guys would really benefit from having a YouTube channel too. I think it would kill it.
You know what? We have to. We've been talking about like doing this and like even like short videos of like little capsules on different things that we do. Yeah.
There's this YouTuber I like to watch. He's like a YouTube bodybuilder. He's from Canada. His name's Will Tennyson. He goes around to a lot of these gyms who are expensive, but they do the most. I think your guys' clinic,
Huh.
one of his episodes would be incredible. Yeah, you should check him out. He has like millions of subscribers.
That's cool. Yeah, I will
He's from
definitely.
I'm not sure
Yeah.
where in
Yeah.
Canada, but nonetheless.
Yeah.
Well,
That's all.
thank you, Francesca. This has been great talking about all this. I mean, truly what a cool company you guys have. And I hope that more people can learn about you guys and get the correct care that they need.
Yes, exactly. It's just to be in front of people that really do need it and that want to stay in the country. Yeah.
All right. Well, thank you guys again for tuning in on Beyond the Clinic Walls, and we'll catch you on the next episode.